Welcome back to the Resonant Life podcast. I'm your host, Dr. Leila Doolittle, and today I'm joined by the incredible Dr. Jaban Moore, a leader in root cause functional medicine. In this episode, we explore why conventional medicine often fails to address underlying chronic disease by not going to the foundations and the root causes, the hidden stressors that can drain your body's energy reserves, and how simplifying functional medicine can accelerate healing. We dive into nervous system regulation, the power of self-trust in the healing process, and how clearing environmental toxins can radically transform health. Dr. Jaban also shares his revolutionary approach to functional testing, patient empowerment, and restoring true balance without overwhelming protocols. Dr. Jaban is a renowned functional medicine practitioner specializing in Lyme disease, stealth infections, mold toxicity, environmental illness, and gut dysbiosis. His mission is simple: help people break free from chronic illness by uncovering and addressing the true underlying causes of their symptoms. Through precision lab testing, detoxification strategies, microbiome restoration, and mitochondrial support, he has helped thousands reclaim their vitality. This episode is a must listen for anyone seeking a deeper understanding of their health, a roadmap to healing, and the inspiration to trust their body's innate ability to heal. Welcome to the Resonant Life podcast. I'm your host, Dr. Leila Doolittle, and today I have the immense pleasure of having Dr. Jaban Moore here on the podcast with us, and I'm so thrilled to get to share with you all his wonderful wisdom. Dr. Jaban, I have known you for several years, and you've been a huge amount of inspiration in me, my own practice, and just you brought so much wisdom to healthcare, and you're an inspiration to so many functional medicine providers. So today I want to just open the platform for you to share a little bit about what really got you into this, what is inspiring you, how are you such a heart-centered doctor that is able to show up in so many profound and big ways, creating a huge ripple and wave in healthcare. And what is that motivation and that drive, that force field behind you that's really fueling you and creating this passion?
So many parts to that story as you move through life and you just pay attention to the world you live in and the beauty, the amazing stories of people overcoming so much.
Yes.
And specifically talking about this health, right? Like you see people that can overcome autoimmune diseases, can overcome chronic illnesses. And then I see what my mom went through and her misdiagnosis when I was 10 years old. She was 40. And I just, as a young child, remember how that affected me.
Wow.
I remember how deeply concerned and how much pain she was in. She was concerned about me. I was concerned about her. She lived on a couch, basically, in our house because she would go to bed during the day and my dad would go to bed at night. So, I know as I went through school, as I went through undergrad, as I went through my master's, I got into chiropractic school, I got into practice, and I just know that there are so many other people out there like me that had a parent, a family member that's suffering. It doesn't have to.
Right.
And that's what really drove me to being where I'm at, because every day I get to talk with clients because I'm still working with clients in person and virtually. And I see parents get on the phone, get in the Zoom link, and their goal is to be there for their kids.
Yes.
I see grandparents. I see entrepreneurs that want to be able to affect the world. So for me, it's a passion because, when you get to the end and you're just like friends.
Yes.
And you're so excited for all the things that they even forgot that they enjoyed.
Yes.
So that's a big motivator for me. And it's a big motivator for me because I was asked one time, what's my big, hairy, audacious goal? And I was like, I don't know. I don't think like that. I just go. But they kept poking me at like the conference I was at. And I'm like, fine. All right. What is it? Like, it's to give every person that I possibly can through my social medias, through my email list, through my practice, the ability to have a true informed consent about their health decisions.
Wow.
So it's not to tell them they have to do it my way. It's not to
Hmm.
tell them they have to do it the functional medicine way or the natural way. It's to just inform them that here are your options.
Yes.
This is the actual reality of what those choices will make. And now
Mm.
you can go make that choice. And I'm going to throw myself under the bus here. And people sometimes get mad about it. Every now and then, I like to be with my friends and have a smoked old fashioned. It is bad for me. I can tell you through my HRV. I can tell you through my blood sugar. I can tell you through the inflammation it does in my body. But every once in a while, I want to do that. I have the ability to make that decision.
Yes.
And I also know that I can not eat junk food and I eat organic food and I work out
Hmm.
and I sleep well and I do all these other things to help improve my body so I can handle that and I can do the things that I want to do. And I want other people to be able to do that with their health. I want them to be
Yes.
able to decide whether or not antibiotics are for them,
Right.
decide whether or not going out and getting a vaccine or using fluoride toothpaste, or for people to understand that honestly, I barely ever get sick ever. My clients that I work with
Yes.
barely ever get sick. They don't feel bad. They're not tired.
Mhm.
That the mainstream, what they consider to be common,
Yeah.
IBS, chronic fatigue, autoimmune diseases, MS, menstrual issues, PMS, don't have to be normal just because they are common.
Right. There is another way. That is so powerful. And you empower them by helping them to shift out of that and open their mindset just within that first visit so that they understand that their innate wisdom that is inherent in them, they can heal and they can make choices that are working towards their health and also giving them that flexibility to still live life, to not have to constantly be in an elimination diet or constantly have to give up the things that bring them joy, bring them excitement. If it's a smoked old fashioned with friends, there might be so much joy from that in those moments that is not that bad and detrimental for their health. And they're able to make better choices to make up for those little cheats. I love that. That's beautiful and so empowering. There are so many other types of functional medicine practitioners where I think that they'll give very relevant and important health details to their patients. And it does help to a certain extent, but it also is so difficult for that patient to walk those journeys and they get so overwhelmed by the process. I think that there are so many ways that we can get very strategic and very targeted and get to the true root cause without all the extra fluff of healthcare models that we layer in, all the extra programs and supplements and things like that. Tell us about how you've done this because you've created this amazing way that we all of us functional medicine practitioners are watching how you work with patients, and it's helping inspire us to get more strategic and more simplified. So I would love to hear your perspective in this about how you are getting to those core root causes of a patient's health and actually creating a massive amount of change very quickly with the simplification of it.
Yeah, well, let's start off first with the most common medicine right now, Western
Hmm.
medicine, right?
Yeah.
Western medicine is let me give you a magic pill or a surgery, and then you're going to be all better, and you don't have to think about your health anymore. Which is honestly, it sounds nice to not have to worry about it. Unfortunately, 75% of Americans right now have some sort of chronic diagnosis over the age of 40, whether that be high cholesterol or blood pressure or pain or depression or whatever that may be. So it's not working. The magic pill solutions are not giving the outcomes that we all want, which is to thrive
Hmm.
and not really think about our health and feel good.
Yes.
So that's not working. Well, then we have functional medicine. And what is that? Functional medicine is a couple of different things. You have the provider that says meds are bad, take all these supplements to replace them. So it's still like the magic pill kind of treatment. And I don't like that either.
All right.
Other functional medicine providers are you have to live a very particular kind of life to avoid all the toxins, to avoid all the stressors, to take all the supplements, to do all the activities, whether that be a castor oil pack, a coffee enema, dry brushing, a breath work. You got to do all these things every day. You got a mouth tape, you got to sit in your red light, and you're spending half of your day
Yes.
trying not to get sick. And I say that way on purpose. You're spending half of your day trying not to get sick versus the other part of the population doing Western medicine is taking this pill and they're like ignoring health. to some degree, but they are sick in a lot of cases.
Yeah.
So I said, okay, well, I don't like either model. They both feel lacking.
Right.
I go, what is the goal of every person that comes to my clinic? Well, it's to feel good. So feel that vibrance.
Yes.
Yet not spend their entire day or half their day or whatever it is to that person thinking about health. I go, my goal for them is to have to do a few health tasks, right?
Mm-hmm.
A few, and to feel good,
Right.
like to get to our goal. So while we're going through the meat of the work that we're doing, I said, how do we do this? How do businesses operate? Well, if they're a good business, they systematize it, they automate it, they build it out in a way where they can get the most out of every dollar they spend in the business.
Yes.
I somewhat think of a human body like that, which can be a turnoff to some people that are like, well, no, we're living organisms and we need love and caring. And I'm like, yes, you do. Absolutely, I agree. Your nervous system is the bank of all the interactions that your body goes through.
Right.
So your nervous system, when you're living in mold, is taxed
Yes.
by mold. It's also taxed by having to simply just breathe and digest and recover muscles and grow hair and new skin and deal with the people around you and do your work. So it's this system is the nervous system, and it is paying the bills all day with its energy and its immune function and everything else.
Yes.
So if you have 100 points or $100 of nervous system currency to spend, and half of it is just on digestion, which is what the science shows us, and then you have a little bit more on childhood trauma and a little bit more on mold and a little bit more on your job and a little bit more on your kids and a little bit more on cleaning the house, at the very end of the day, dealing with mold toxicity or parasites or Lyme disease, you may only have 10% left.
Sure.
But if you're handling all of it, you're well.
Yes.
If it takes you over that threshold, that's when symptoms start becoming a problem. That's when you go negative. That's when your bank account is unhappy, right? That's when you're running credit card bills up, and you can only do that for so long before things crash and burn.
Right.
So what I talk to people about is oftentimes when we meet, they're on all these supplements, all these lifestyle habits. Or they've been told you have to do vegan, you have to do carnivore, you have to do X, Y, Z. And I'm like, no, like here's the reality. My end goal for you is a whole food diet, mostly organic, maybe on a supplement or two. It's doing routine exercise like we're supposed to. Let's call it 30 minutes every day. I do more than that because I love it. But maybe you don't. So you still have to move as an animal. You're a mammal. You still have to move. The human organism requires movement. So sitting on the couch watching TV is not going to be acceptable in this plan. But at the end of it, we need to be able to maximize the amount of energy you have to live the life you want to live, because that's going to make you the happiest.
Yes.
So as we go through this journey, my first step is stop doing all this crap and see how you feel. Find a real baseline.
Right.
And I'm not telling you the supplements you're taking from your other doctor, your functional medicine doctor, your naturopath, your nutritionist, or that Instagram account that you trust is bad. I'm just telling you that I want to find out what is valuable to your body.
Right.
Because, and you can back me up on this, because I think you're one of the smartest doctors I know when it comes to physiology, right? Like, you know, everything, hormones and brain and gut, like you taught the classes for the companies.
Thank you.
Your digestive tract has a limitation on how many things it can possibly absorb.
Yes.
And it takes energy from you to think about purchasing the supplements, because you had to spend energy to make the money to get the pill.
Yes.
You have to pull the pill out of the bottle and get it ready for you. You then have to take it and put it in your mouth, swallow it and digest it, and then understand where it's going to go, like your gut does subconsciously.
Yes.
Has to figure out what to do with it. And most of the time, if you're taking more than a few pills, you have really expensive poop. Because you're pooping it out. Your body's not absorbing it.
Absolutely.
So let's come off of everything. Let's stop all the activities and let's see where you're at.
Yes.
And oftentimes it scares people. And I just say, okay, cool. Stay on that one thing that you think actually does something for you. That's totally fine. I believe you. Come off the rest. And what most people find out is they actually feel better.
Yes.
When they come off of all of this other stuff they're doing.
Absolutely.
for those who are doing a ton. And if that's not you and you're listening, you're like, this doesn't touch me, then okay, good. We'll get to that in just a second.
Mm-hmm.
So once we stop all this stuff, if you feel worse, we'll add some of it back in. Simple.
Yeah.
Then we get labs back and we figure out where we actually need to go. We do history, we do muscle testing, we do the whole 9 yards, everything that we need to bring in to get information about you.
Yes.
And I created a system where, of course, you fill out paperwork everywhere you go, but my paperwork actually automatically inputs into our note. So every provider that works for me has all the highlights, every single one of them in there. And we go through your childhood and then your adulthood, and we go every 10 years and we make sure that each line is filled out. We look at the air you breathe, the food and water you drink and eat, the hygiene products you put on your skin, the dental work, and implants in your body. And we make sure we don't miss it because it's a check bubble. So every single practitioner is making sure not to miss those pieces.
Yes.
Because some of the doctors that I talk to at the functional medicine events are brilliant and they have no system and they accidentally forget to talk to you about that one thing.
Yeah.
And that one thing might be why you're not getting well.
Yes.
I can't tell you how many times I've run into people where they've done mold and they've done that mercury cleanse and they've done all the other metals and parasites and Lyme and you name it. They've looked at their methylation pathways through epigenetics. They've done functional neurology. They never checked their water.
Yes. So
because they were doing an ion or a carbon system and it was good enough. And I'm like, okay, well, I just ran a hair test on you and we see radioactive elements and it's off the chart and simply stop drinking that water. I've had people get well right there. That was it.
Simple.
A week later, they're like, okay, my body's operating because they already did so many good things.
Yeah.
Or their provider never asked them if they simply just internally feel safe. And I don't mean safe as in you think somebody's going to break your door down and kill you, but you don't feel stressed or in fight or flight. And if you're listening to me right now, you're like, wait a minute, what does that mean? And you leaned into the screen, your shoulders raised. It probably triggered you a little bit. So I watch clients and people that are with their chest pulled together, this is a state of stress. Shoulders up, state of stress. So if you can lower your shoulders and bring them back down right now, either you need to work on your posture or maybe it's a state of being in a little bit stressed or fight or flight.
Yes.
If you're listening to this and going, I need to make sure that what he's saying is the perfect, exact thing before I want to execute on it, every decision has to be just right to move forward. That's a state of freeze. If you identify with this statement, man, sometimes I just don't act like myself. Like my friend was saying something to me and I responded irritably. That is fight. Yes. Fight, flight, or freeze. This is a nervous system state. So we go through this system that gets you back to a baseline, figures out what that looks like for you, gets all this data so that we can input this into a roadmap. Make sure that there are not things in your environment that are going to keep you from getting well. Just today, one of my docs sent me this big message. It was really long. It was all this stuff about a client. And this person had been 20 years sick, moved into the house 1 year after starting to feel sick, but been there for about 20 years. Been through Mayo and Vita and all these other really good clinics that are very well respected. Got results at a couple of them, but the stuff always comes back. I looked through the labs. She's like, am I missing something? And there were these little minuscule signs that I went ahead and taught her that we just had to refresh. There's mold. There's absolute mold. This person had oxalates.
Yes. 4
markers in the mitochondrial markers on an organic acid test, which to me signifies mold. Had methylation toxic exposure marker that was slightly elevated, but only had a creatine level in the urine, which is basically telling us how much your body's detoxing, of 39. It needs to be 50 at minimum. I like it at 100. So all the markers are going to be suppressed, even though the ones I'm mentioning are high.
Yeah.
So we spend time every month, once to twice a month as a team, rehashing out all these little case studies, all these little pieces, and making sure we're not missing those basic integral beginner pieces of environment, body feeling safe, meaning no anxiety, depression, irritability, no fight or flight symptoms, and actually finding what a real baseline is without all the Band-Aids so I can see the person for what their physiology is, not for all the Band-Aids that are put on it.
Yes. Oh, I love that.
And to clarify, I am not pulling people off of depression medications or things like that.
Mm-hmm.
I'm more concerned about like the functional, natural band-aids that have been applied
Yeah.
because I don't want to put someone in a bad spot.
I love that. Simplifying it so you can listen to the information of the body that the body's putting out. And our system is constantly sending out signals and telling us what is wrong, what's really dysfunctioning, and just trying to wake us up. And I feel like the body speaks through symptoms. It's like whispering the symptoms for a while, and it starts to get bigger and bigger with the way that it's creating symptoms. And then we get syndromes, and that's where it's speaking to us. And then dysfunction disease is like it's yelling at us and trying to get that information out. And just if we don't have a practitioner walking by our side that's listening to these signals, then it's like it'll go all the way to the point of dysfunction and disease and now big diagnoses. And all that time, we had those opportunities to listen to the whispers and the subtle little cues, the subtle signals. So it's beautiful that you're fine tuning the way of listening to the system and really reading between the lines and understanding those subtle hints that everybody has, and the intake form or the labs, and just listening to the body by going back to that baseline so we can get back to the core of it and really listen to what the body is telling us. That's beautiful. And I think that can be an inspiration for so many functional practitioners out there, as well as all the patients that are searching for those kinds of practitioners. Something that made me think while you were talking about it is in the beginning, as you're taking patients off of the protocols that they may have been on for so long, that may have been just overwhelming their system, that their body is just not able to listen to that information because it's so much coming in. It's so many different supplements, so many things that they're trying to do. It's just overwhelming to their bodies. It's almost like there can be a bit of a codependency state on it. So like the mindfulness or the mindset, it's like there's so much fear that can be underlying or anxiety that can be underlying when we are just so dependent on certain protocols and we think we have to take these 20 different supplements per day just to feel well. And if we don't, then what will happen? Is our system even going to have the information that it needs to function? And it's so powerful how there can be such a profound shift in the brain, in the mindset, and the nervous system when we take all of these external factors away, all these extrinsic modalities, and just let your system go back to that baseline, go back to the quiet, and get back to the trust, the self-trust, because then your nervous system trusts, oh, actually, I'm okay. I can heal. And it's so simple. And maybe these 2 or 3 little supplements that my body actually needs was all that my system needed to depend on. And even then, it's just working with it. So I think that's a powerful healing factor whenever you're helping them switch from that codependent state.
Yeah, it's trust. You said it.
Mm-hmm.
It is trust. That's a trigger word for some. Trust, trusting your body to do what it was designed and meant to do, which is be well and to be healthy. That's not something that we're taught in schools. It's not something that we're taught in standard medicine, that the body itself is pretty incredible. And you see this in so many ways. I mean, you see Olympic athletes, you see people that are 100 plus years old. And it's funny because clients come in and they're like, I'm 40 years old. Things are just going downhill. And I'm going, yeah, why is that guy out there running a marathon that's 80? Right. And when people start to realize their bodies are designed to be healthy,
Yes.
and they start to believe that that is where they're going to end up, and that it
Mm-hmm.
is simply just a process.
Yes.
Now, that is unique to you. I'm not saying this is something where everybody fits one mold. They don't,
Mm-hmm.
which is why the way that we've designed our system is here's all these different potential things that can hang somebody up.
Mm-hmm.
Let's make sure that we put this together for a specific individual, because you're not going to need all of them. You're going to need some of them. It's going to be different than most others. But let's not miss those things. And when you do that, it takes the stress off the doc so they don't burn out, which is great. So they're more passionate. It takes the stress off the client because they
Yes.
see a process coming. They see a roadmap ahead. They
Mm-hmm.
they know that it's a road with a beginning,
Mm-hmm.
and you're eventually going to come to an
Yes.
end of the process that we're working on. And by the way, the end doesn't mean you're done knowing that health exists. It
Right.
means that we're done with what I call like the active chronic illness phase. And
Yes.
then you journey into, the word maintenance or continued
Mm-hmm.
care is out there, but
Yes.
I actually kind of am growing on this word of biohacking because it's like the word I didn't like for a while, but I'm going, it really is, because when you care about your health,
Mm-hmm.
now it is no longer a labor to go to the gym if that's what you love, or to do the breath work, the yoga, to go on the walk, to eat healthier
Mm.
food. Like it almost becomes a passion.
Yes.
And sometimes for some people, especially if they fall in certain categories of personalities, such as OCD or perfectionism, they can get a little too far. And I always kind
Mhm.
of push back gently against those clients like, hey, I know that you can eat perfectly and do all the things, but do you need to? So for me, it's just truly finding balance.
Yes.
And balance is a boring word, and it's not a controversial word, and it's not a word that's good for a podcast title or an Instagram, but it is truly what makes the body healthy.
Absolutely.
And balance just means your immune system, your nervous system, and your mindset actually all are on the same page.
Wow.
Your mindset means that you know what your body needs and you give it to it.
Yes.
Your body knows that you're not going to put it in bad position, so it doesn't live in a state of dysregulation. We call it
Mm.
autonomic dysregulation, where you could have POTS or MCAS or SIRS. You can have all of these signs or symptoms. So your mindset is in a place where your nervous system trusts it, and
Yes.
your immune system knows that your nervous system and your mindset are in the right place, so they trust it. And then
Mhm.
your mindset can trust those two things because they're operating together, and it just
Yes.
works, and it's the
It
way it's supposed to be.
does.
And that person
Mm.
out there that's just like, I don't get sick. They don't really do a whole lot of things, but their mindset's around that and they're confident in it.
Yes.
And it's
Yeah.
true, right?
It
Like it
is.
works. They're
Yes.
not worried,
Right.
and worrying takes energy away from your body's ability to operate normally.
Yes.
So go back to that bank analogy and just think of your body as a bank. Where are you expending energy
Mm-hmm.
on your day to day that is unnecessary?
Right.
And if you don't know, you can do what I do with some of my teammates in my office: write down everything you do every 15 minutes all day long for a couple of days, and then audit it.
That's a good
What
idea.
are you expending energy on
Right. And is it worth it?
that is not valuable to you?
Right.
Is
Hmm.
it worrying about things you can't change? Is it avoiding certain people or phone calls? Is it watching TV where you could be on a walking pad? And I'm not a personal trainer, so I'm not going to like go way down that rabbit hole.
Hmm.
What are you doing? Where's your energy going? Because when
Yes.
you have more energy in excess, right? When you have excess energy, your body goes back and fixes the problems that it's dealing with.
Yes. Absolutely.
If that's achy joints, they probably fade away. If that's inflammation, it goes
Mhm.
down. If
Yes.
that's hair falling out, you start keeping your hair and making more of it.
That's
If
right.
that's aging skin, which is going to happen at some point, but if it feels more rapidly, it's
Thor.
going to stick around. It's going to do better.
Yeah.
If it's
Absolutely.
you don't feel like doing your job or hanging out with your kids because you feel overwhelmed all the time or unmotivated to do life in general, including everything I'm
Mhm.
saying right now, you start getting more and more energy, and then you're wired. And here's
Yes.
what happens for me: when I do the things that I'm supposed to do, which means get to bed and get at least 7 hours of sleep each night, I get to a point where I'm like, I'm ready to just crush life, like
Yes.
do my job, spend so much time with my kid,
Hmm.
work out. And I get to where I'm like, okay, I need to start winding down at 9 o'clock at night to go to bed. And I'm like, I could be doing more till like 3 a.m. because I'm like just hyped about life when I do the things I know I'm supposed to.
Yes.
That's how we are all supposed to feel.
Abundance of energy. Yes.
If you don't feel that way when you're doing the things right, what are you missing?
Yep.
Where is that energy going?
Yes.
Is it going to detox mold because you're breathing mold in?
That's
Is it because you were taught by your mom that you should worry about how your home looks every time you have a guest. So you spend a week cleaning your house and making it perfect and worrying about what other people are going to think. Because is that a useful value for your energy? It's
Mm.
probably not. I asked this question to a lot of, and I'm just going to say it, women that are in my clinic, because men typically don't do that. I mean, maybe they do, but they don't tell me about it. But I've had a lot of women where they're like, yeah, I'm just, I'm so burnt out. Like Christmas is next week. I'm trying to get everything perfect. And I go, why are you faking your life?
Boom.
That is not how you normally live, which is why it
Right.
takes so much energy to change it.
Yeah.
And if these people really love you, they aren't going to care as long as, again,
Not at
we're
all.
within reason. And if they do, and you're like, my mom will come in and tear me down because my house looks a certain way, well, now you know where your habit came from.
Probably the illness is being contributed to by that too.
Nature versus nurture, right? Like
Yeah.
you're getting this worry that isn't reasonable, that isn't valuable, that's
Mhm.
taking away from your life.
Mm-mm.
And maybe she got it from her mom. I'm not blaming your mom. I'm just saying this stuff gets passed down. This is why
Does.
there are families of people who are obese because it's the way they eat. There are
Yes.
families of people that get certain diseases like diabetes or joint problems because the way they move or the way they behave or
Mhm.
what they eat. Mental health is the same way. You
Absolutely.
may have came by your anxiety,
Mhm.
perfectionism, behaviors
Mhm.
honestly because they were trained into you through your parents, through their parents, through theirs.
Yes. Wow. And that breaks the cycle. So then not only is it so profound for that patient's health and their journey into wellness, but then their children, their friends, their family members, everyone around them just now has a different inspiration by the way that they are, by the way that they've shifted that
Yeah.
mindfulness in their mindset.
And when you realize, when you defrag your life, like a
Oh,
computer, if you remember those terms, right? Like I'm old
yeah.
enough.
I
You're
am
ready
too.
to defrag your computer. Well, now they have AI. You can do it to your cell phones, your computers, and everything. When you defrag your life and all of a sudden it starts running more efficiently, there
Mhm.
you go. It makes sense. And here's the thing when you defrag your life, you teach your loved ones and your significant others, specifically your children, to
Yeah.
never have to defrag that part of their life.
Hmm.
So like you said, you cut that continuation
Yes.
going forward.
Hmm.
But here's something that I've actually just loved, and I joke. I mentioned earlier, every now and then I like to have a whiskey, so I'm going to bring it back to that. It's a joke that I have with my clients, and when we become friends, they appreciate it. When they're sick, they don't appreciate it as much. Um, when I get somebody, whether it's a man or a woman, going through a protocol, and they have some of those very rigid mental health
Hmm.
pieces
Yeah.
that even they don't like they know that it takes energy from them. And we
Yes.
get them doing some mindset practices, doing different things like primal trust or some of the work that
Mhm.
you've put together. When we get people doing those things and it shifts their outlook on life, like they just start having more joy, they
Yeah.
start having more fun, they're not so worried about things. I tell
Yes.
their significant other, I'm like, so actually I really like this, if you just send me a bottle. And it's a complete joke,
It's like, you're
but
welcome. We're giving
But
you back your
like I've
smile.
seen marriages
Yes,
become so much better when a person isn't
absolutely.
stuck in fight, flight, or freeze.
Mhm. And how powerful to bring that in, because that's like one of those crux things that's such an extension of your true being, and health can just suffocate that, those aspects of who you are, that authenticity. And yeah, you're right. It can affect marriages to where they can unravel before someone gets back to that state of well being, that state of wellness, where they're able to shine that beautiful light back out. That's so beautiful. Such a good way to think about that. Yeah.
And I got to throw this out there.
Mm.
If you shift and you know in your heart that you're going the right direction and the people around you aren't shifting with you or they are negative about it, don't necessarily think that you're the problem.
Wow. Yes.
So I've seen it inside marriages, and I've seen it just in friendships. I've seen it in businesses. Sometimes if people around you are not willing to go with you,
Yes,
then you just outgrow them. And
absolutely.
that's not a bad thing, because if you have profound health changes and get well and you're happy, and because I used the example earlier, and your mom keeps trash talking your house because it's not always perfect, maybe it's not you that has the issue there.
Yep.
You can still love your mother. You don't have to cut her out of your life. You just have to say, okay, I know where you're at. I've been there. I love you.
Yeah.
And then just move on.
Right. Wow. And how beautiful to have that self love and self respect to establish healthy boundaries
Mm-hmm.
to protect this, because now it's time for her lesson. I think everything in life, we're constantly going through lessons and learnings, and it's time for her to learn. And it takes a difficult time. Maybe that's her school of hard knocks, is that she needs to understand there's that strong boundary that she put up, that she put there between those individuals, and it just has to happen, or spouses, or anyone, family or friends. It happens. Wow. Okay, so this is powerful. Now, you mentioned the defrag of the computer. That gave me some ideas about software updates. That creates more opportunity for software updates, like consciousness expansion. So many people are playing small in their lives, and they are only the short version of themselves of what they think they can achieve or what they can attain in life, or maybe like the adventures that they put on their bucket list are just a relatively short and small list of things that they can drive for and seek to bring into their life. But it's just because they only have so much capacity. Whenever they do that defrag of their system and they reset it, then they open up so many new possibilities. So that consciousness expansion of what they can perceive or what they can bring into their lives is so much more profound, so much more powerful. They can actually imagine themselves in such a greater space or greater capacity. It's beautiful. I had that idea. And then also, when it comes around to spouses getting healthy, and when it's an inspiration for those around them or family members, like parents or kids, to get healthy along with them, it's an evolution. It's a becoming better, becoming a greater version of themselves. And hopefully that inspires others to move forward. But there so often is just different seasons of life. And maybe we get inspired and find that opportunity to step up and become a greater version of ourselves. And so we choose to walk that journey towards evolving. And if that's a wellness journey that then leads to this mindfulness shift, and now there's greater capacity for this consciousness expansion and just more authenticity in themselves, then hopefully that's an inspiration for those around them. And when it's not, when it's like a different season and someone wasn't able to evolve with them, oftentimes there can be that little lapse time where they have to have that decision of how long are they going to play small or continue to just keep growing and stepping into that greater version of themselves.
Yeah. We're always changing and growing. You just have to choose what direction you're going.
Yes, yes. And I think that is one of the powerful things about how you've designed these like levels of healthcare, is it's not just about trying to restore function or get them to a higher quality of life, or restore the regeneration and even lean into longevity and the healthy anti-aging. It's more about who are they, and what is it that they're going to express themselves as, and are they able to be in this constant growth state to where they have that deep self-love and appreciation for themselves, and they're able to feel that appreciation for this evolutionary process of how they're being. That's beautiful. I think you inspire people quite often because of the way that you've walked your own journey. You've had your own health journey in this, and you've paved the way for so many. And then you're giving them glimpses of what it can be like if they join in this journey as well and walk a path that will lead them to that state of expansiveness. It's It's amazing. Okay, so tell me if is there anything that you feel can be a powerful and profound just nugget of information, truth, inspiration, anything that has really touched you deeply in your heart?
Oh, when I think about mindsets or statements or just impacts that people or events have had on me, and my health journey brought me to where I am. I've had a lot of amazing mentors in the world, and I think as we're going through our journeys of life, a statement that really shifted me was a person asked me if I'm building my prison or my dream.
Wow.
So whether it's the job you take, the lifestyle choices you're making,
Mm.
the people you're surrounding yourself with, are you building your prison or your dream? I had worked myself into a corner. I was doing what I thought I wanted to do. I was working in my clinic. I was working like 90 hours a week because I wanted to take on every client, help every single
Wow.
person. And although I loved helping, my dream was to have a family and to be able to take care of them and be involved and be at the football games and soccer games and all the things that my dad did for me, because
Mm.
my dad was incredible. I mean, he was just there for me in every way. If I ever needed help, he was always able to be there. And I realized as I worked myself into the prison, it was going to take time to get out of it because I wasn't just going to drop on my clients, but I was definitely going to shift some things and change the way that I operated and become more efficient. And that's what created a lot of the systems that I've been able to create. That has shifted my mindset to more of the minimalism mindset,
Mm.
not just like, live in a tiny house or something, but as a perspective of what I commit myself to. And even in the health realm, the number of supplements I want to take.
Yeah.
So just as you sit here and you listen to everything I'm saying, and my analogies have been, your nervous system's the bank, it's paying the bills.
Yes.
Where are you putting that energy?
Mm-hmm.
Is it something that you want because it's that dream, or is it the prison? And you're going to definitely do things that are not everything you want to do. I don't want to pay my bills. I don't want to spend time on that. I'd rather someone else do that for me. Sometimes I don't want to cook my food or whatever, but it's just like, what trajectory are you on? And if
Mm-hmm.
you put everything through the frame of, is this leading me at some point toward the dream? You have a different perspective. And this is not to say that there's going to be things that you're going to do that you don't want to do. I had to go through school to get the degree to be able to do this work that I love to help the people that I'm helping. By no means do I ever want to go back through school. And did it definitely feel like a prison? For sure. Taking all those tests and boards and late nights and who knows what. But it was toward the dream.
Yes.
So I think just evaluating your day to day in a way in which you have a bigger picture is going to help you to get a better outcome versus when you're stuck in fight, flight, or freeze,
Yeah.
having the blinders on and simply
Mm.
just getting from one step to the next because that's as far
Yeah.
ahead as you can look.
Wow.
Sometimes you have to, when you're in that state, because you don't have the vision to go months and years in advance. But can you go, okay, out of the next few things I'm going to do, is there a faster or a better way? And then start slowly getting back more of you
Yes.
so that you can put it where you want it to be.
Wow. I love that. That's amazing. What a beautiful nugget of wisdom to share. Thank you. And
Absolutely.
it's so beautiful because as you're explaining it, I feel it from your heart. And it's you have so much expansiveness in your heart, so much capacity to care so much. And that's exactly what is incredible about your inspiration that you're sharing with every one of your patients, with so many other practitioners out there, with everyone in your vicinity, in your field, they feel that. They feel that authenticity that's just radiating out from you.
Well, thank you.
Yes. Okay, so we're winding down and we're finishing up this episode. I wanted to ask you one little bonus question about your ability to read the bodily expressions and the different, it's amazing how it's like an entire language, body language, that you know better than anyone that I've ever met before. So tell us a few interesting ideas about this, just a few little bullet points so that people can see body language as an entirely new thing. It's an incredible field for functional medicine practitioners to be able to see this in their patients, but also it's just fun in general.
Everybody has the way they speak, their accent.
Hmm.
Everybody has the way they move. It's their body language. And I mean, whether you're talking about poker champions looking for a tell,
Mm-hmm.
your body has a lot of tells, whether it's you'll do it, but you don't want to. You're lying where people will tell you, you're looking out, you're looking with your eyes away. You're, I don't know, when you give someone a compliment, they kind of look down and away and just kind of crouch because they don't know what to say back.
Hmm.
Everybody has their movements. And I'm sure if you talk to an expert in this, you'd find that there are lots of movements that people do together. But what I've been able to do is I just like pattern recognition. That's just something that I enjoy in general, pattern recognition of what labs look like between clients so that I can pick up on things in a CBC, CMP, that isn't necessarily there,
Hmm.
but the patterns are there to tell you what's coming next.
Mm-hmm.
So when a person that you're around or you're talking to or a client that's on the call with me, if I've seen them enough, you start to see patterns when they're telling you about their day, why they did or didn't take their supplement or did or didn't accomplish the task that you asked them to do. And you can start to see that maybe the request that you're making as the provider is too much. And even though you know that they're all going to be effective, it's too much.
Yeah.
This is part of where everything we talked about today came from is I
Yes.
realize that sometimes, even though it's what we need to do, it's stopping us from doing anything.
Yes.
Because with many people, it's not an all or nothing. It's
Mm.
a nothing or something, which is a different perspective, right? So
Mm.
I can give you a couple things and you'll do that, but if I give you one more, you'll do none of it. So with body language, it's just learning the person and all of their languages,
Mm.
whether it's their verbal, their accents, but it also can come to the way that they fill out your paperwork.
Mm.
So I will have people fill out before they get on a call with me a journal, and that journal has them list their symptoms and rate them 0 to 10. So this is more of an analytical response.
Mm-hmm.
And then when they get on the call, I will ask them why something potentially got worse or better and just
Mm-hmm.
have them explain to me a little bit. And sometimes their answers are completely different. The numbers went down, but they think they're worse, or vice versa. So this tells me about them. If they think they're way better verbally, but their numbers are worse, they're optimistic, which is good. But I also have to make sure that I'm taking that information into account and
Mm-hmm.
figuring out why their numbers are worse. And if their numbers are worse, but they think they're better, right? Versus if they think they're worse and their
Yeah.
numbers are better. If they think they're worse,
Mm.
but their numbers are better, are they depressed? Are they stressed out?
Yes.
Are they not evaluating themselves? Do they have a perfectionistic
Mm.
mindset where it's all or
Mm-hmm.
nothing? All of this helps me to learn how to have a conversation with them to one, help shift their mindset, but
Yes.
also to create motivation. And thirdly, to be able to do what the right thing is to move the needle forward, right? Like to be
Yes.
able to get results. So it's
Mm-hmm.
not just body language, but it's all language coming from that person because they speak through every act that they do, including breathing. A big
Yes.
deep breath, you're like, oh, that person, like, if you ask a person a question, take a big deep breath, you're like, oh, was that like a heavy question? Everybody does that, right? So just expand it.
Right. Wow. I love that. That's amazing. And so relevant for so many people. They can even apply this in their own lives with their spouses, their children, their parents, their family. They are able to see the subtle signals behind the scenes. Dr. Jabin, you have a brilliant brain, and I'm so thankful that you shared this time with us. Thank you for sharing so much wisdom, so much knowledge, and most importantly, your heart. I appreciate you so much. And I hope that everyone that is listening does as well. Thank you so much.
Thank you.